I'd like to start us off by introducing Dr. Paul Nestadt. Dr. Nestadt is an assistant professor of psychiatry and behavioral sciences at the Johns Hopkins University Bloomberg School of Public Health, and he's also the co-director of the Johns Hopkins Anxiety Disorder Clinic. His research focuses on epidemiology of suicides and the role of practical factors such as opioids or firearms in the risk of suicide death. And so we're grateful to have Dr. Nestadt here to share about his research and to learn more about suicide and access to lethal means.
Hi, thanks. I'm going to try to share my screen so that I can show you some of these slides. Let's see. Are you able to see this? I hope so. All right, so I'm Paul Nestadt, as mentioned. I'm a psychiatrist and I specialize in the epidemiology of suicide. So, we've been hearing a lot about gun violence writ large, and you just heard about some differences in the homicide rate and suicide rate across the county. Nationwide, suicide remains really one of the leading causes of death in the US. It's the 10th leading cause of death overall, but it's also the second leading cause of death in young people, basically anyone under 40. It's the second leading cause of death. It's particularly troubling because the rates have been climbing pretty steadily throughout the 21st century, essentially. This figure condenses the second half of the 20th century, where suicide rates were high after World War II, and started dropping immediately after around the release of Prozac. They started going down around 1987, reaching a nadir or low around the year 2000, but since then slowly climbing. They've climbed about 33% over the past 20 years or so. In Maryland, there's different rates of suicide in different counties. It tends to be that rural counties, just like nationwide rural states, tend to have slightly higher rates of suicide. I've written quite a bit about how that has to do with the fact that there's more availability of firearms in those counties, among other factors. If we zoom in on Anne Arundel, you just saw a map of the different suicide rates across the county. This is over time. These are Anne Arundel suicide deaths from 2003 until this year that just completed, 2020. There's been a slow but steady increase, about a 50% increase from 40 deaths or so back in 2003, going up to 63 suicide deaths in 2020. This is something that we're seeing nationwide. The suicide is obviously multifactorial. It's a behavior that comes from many different factors. Some of these factors are fixed. We can't do anything about them. Like, for instance, having a family history of suicide increases your risk of suicide. Being male, being white, having terminal illness, these are all things we can't do anything about, but increase the risk of suicide. There's other factors that we can do things about. Social isolation, poverty, psychiatric illness, and access to legal means, importantly, are things we can actually intervene with. So even though the rate of suicide is very high, there's many deaths from suicide that we were just talking about, it's much smaller than the suicide attempt rate. This is really important to recognize. I mean, in the United States in the last year, there was about 1.5 million suicide attempts. There are about annually. About 500,000 adults are admitted to the hospital, implying a relatively high lethality attempt. And yet only about 47,000 or 48,000 die by suicide each year. The reason for that is really the important part of this conversation. There's a difference in what the fatality rate is in different suicide methods. Overall, suicide attempts have about a fatality rate of about 8%-ish. But this varies a lot based on the method you use. So poisoning or overdoses are by far the most common method of attempt in the United States. Here in this particular study, Connor study from 2019, there were 2 million attempts by poisoning, far more than any other method. But only about 2% of poisoning attempts end in death. Whereas firearms make up a much smaller proportion of suicide attempts, but are highly fatal. About 90% of suicide attempts by firearm end in death. And this might be the reason that we see such strange things in suicide epidemiology, such as women having 3 times the suicide attempt rate, and yet men having 3 or 4 times the suicide death rate. It might just come down to the fact that women tend to overdose and men tend to use guns, and that high lethality method leads to more death.
So Paul,
yeah,
your slide, we're not seeing your slides advancing, just so you know.
Oh, I did not realize that.
Yeah, no problem.
Let's see. Let's see if I do this one. Are you able to, what do you see now?
Perfect, that's great.
Okay, yeah, so sorry. So there was a bunch of stuff here, but essentially, I was pointing out an increase in suicide deaths in Anne Arundel County and some differences in the suicide rate by method. Sorry about that. All right, so 5 or 6% of suicide attempters use guns, but those become half of all suicide deaths. Half of all suicide deaths in this country are firearm deaths. And importantly, the sort of inverse is true as well. The majority of firearm deaths are suicide deaths. 2/3 are suicide deaths. So when we're talking about firearm violence, mass shootings are very important to pay attention to. They're tragic events. Homicides are tragic events, but the majority of firearm deaths are suicides, something that we can intervene on. Let's skip over this. So if it comes down to the method used in terms of whether someone ends up as a suicide attempter who survives or a suicide death, what goes into the method use? How does that choice become made? What we've learned is that it becomes made based on availability. And to understand that, we have to understand that many suicides, most suicides, are very impulsive. This is a study from 2001, where Simon interviewed about 150 people that had made serious suicide attempts, ended up in the hospital. The researchers interviewed them and said, listen, you might have been depressed for a while, might have been thinking about suicide for a while, but they wanted to know, how long did it take between making the decision to end your life, to act on it, and actually acting on it? And the researchers found that the vast majority of them, 87%, had only decided to make the attempt that day, within 24 hours. In fact, a quarter of people had decided within 5 minutes of actually attempting, 70% within an hour. So if you are reaching this conclusion and then acting on the suicidal thought so quickly, then what it comes down to is what method is available. If what you have in the drawer next to your bed when you have the suicidal thought is a bottle of Tylenol, that's what you'll use. And in that case, the survival rate is fortunately pretty high, 98%. But if what you have is a gun in your drawer and you use that, the survival rate is much lower, around 10%. So who uses a gun for suicide? People who own guns. These are two maps of the United States. On the left, you can see the rate of firearm suicide, state by state. Darker colors mean a higher rate. So you see, if you can see my mouse, these sort of darker states here, what are sometimes called the suicide belt, like Montana and Wyoming. Over here, we see the percentage of households that have guns in each of those states. They look pretty similar. The darker states here match the darker states there. Looking at it a little bit more scientifically, it's been examined on a sort of a area by area evaluation, and found that areas of the United States, metropolitan statistical areas of the United States that have higher gun ownership have higher suicide rates, controlling for all the sorts of things that might go into suicide rates, controlling for veteran status, alcohol use, availability of mental health care. We find that there's about a 50% higher suicide rate in areas with lots of guns compared to ones that do not have lots of guns. This is even more of an extreme difference in kids, where there's a 90% higher rate of suicide in children in areas that have lots of gun ownership. Other studies have found that individuals with access to a firearm on an individual level have triple the risk of suicide. And there's been studies that looked at soldiers. Soldiers have a very high suicide rate. And so they've been studied pretty intensely and found that soldiers who keep a loaded gun at home, not just carrying when they're on duty, have 4 times the odds of suicide compared to soldiers who do not. So I'm arguing to remove the lethal method, but the counter argument is often, if we just remove a lethal method like firearms, will attempters just find some other way to end their lives? This is a very common belief, and actually one that Matt Miller and his group in Boston have examined. They surveyed Americans and asked them what they thought if someone that was going to jump off the Golden Gate Bridge to die by suicide was somehow stopped, would they have just found some other way? Do people believe they would have? And this survey found that about 3/4 of Americans believe, yeah, they would just find some other way to end their lives. The reason that Miller focused on the Golden Gate Bridge for that hypothetical question is that it's been studied really well. There was a really good study that was conducted in the 70s, where researchers followed up with 500 people that had attempted to jump off the Golden Gate Bridge in a suicide attempt and were either physically restrained by the police or caught in the scaffolding or survived the fall. About 1% of people do survive the fall. And they followed these 515 people for a median period of 26 years, long follow-up, and found that a little less than 5% of them ever went on to complete suicide later. And those that did, it was pretty soon after that thwarted attempt, that unsuccessful attempt. And it really speaks to the impulsivity of suicide and the fact that if you survive that attempt, you're not just going to find some other way. Another study in London looked at 100 people that had tried to jump in front of the train, the subway tube in London, which is a highly fatality way to end your life. But they found about 94 people that had survived. And they followed them for 10 years and found, again, less than 10% of them went on to reattempt and die by suicide. There's a meta-analysis that have found these numbers pretty consistently. It's about 6 or 7% of people that survive a highly fatal attempt will ever go on to die by suicide. The vast majority, 94%, will not die by suicide. So what happens when we do take a popular lethal method of suicide, which in the United States might be guns, but in other countries it's been other things, and we remove it? This is a famous study that was done in the United Kingdom. In the United Kingdom, one common lethal convenient method of suicide was to put one's head in the oven. Famously, this is how Sylvia Plath, the writer, died. Ovens were powered by coal gas, which produced carbon monoxide, and carbon monoxide is very lethal. And so all one would do would be take one of these archaic ovens, not light them, and rest your head in there, and you would go to sleep and die. It's a very lethal method of suicide. And it's convenient because everyone had an oven in their house. For unrelated reasons, for economic reasons, there was a shift in the UK from coal gas, carbon monoxide producing ovens to natural gas ovens. And this figure over here shows the ovens switching over across the UK over time. From 1955 to 1975, basically coal gas ovens were eliminated in the UK. And over that same period of time, these figures here look by sex at different suicide rates. The carbon monoxide suicide rate in men, you see, starts to go down around the same, following the same pattern as the ovens went away. Didn't get quite to zero because there was other ways to die by carbon monoxide poisoning, car exhaust, for instance. But the male suicide rate went down. There was not much change in the non-carbon monoxide suicide rate, and so the overall rate went down. Suicides went down when this lethal method was taken away. In women, it was about the same, with decrease in carbon monoxide, maybe some replacement with other methods, but in total, suicide rates went down. In other countries, it's other things. In Sri Lanka, the most common suicide method was, and still is, ingesting pesticides, because it's an agricultural economy. There's lots of pesticides around and herbicides. This is a terrible way to die, phosphate poisoning, but it was a very common method of suicide. This figure here looks at the different methods of suicide in Sri Lanka over time, for about 30 years. This line here is pesticide suicides. You see it is by far the majority. These other lines represent other methods. Here's hanging, other methods. They don't make up a large proportion of suicides. Here, they banned some pesticides in Sri Lanka that were carcinogenic. These weren't ones you would take for lethal overdose, but they were carcinogenic and they were banned. It didn't really affect the suicide rate. But here, all class 1 pesticides, highly lethal pesticides, were banned. And then a few more here. And the suicide rate by pesticide, by poisoning, went down dramatically. It was cut by about half because they were harder to get a hold of. And the other suicide methods maybe bumped a little bit. Maybe there was some replacement, but you can see overall, once this method was taken away, suicide rate was dramatically reduced by half. In the UK, again, they did something similar with paracetamol, which is basically Tylenol, making it harder to get large amounts of that at once to overdose on. In Israel, where soldiers were dying by firearm suicide a lot, they introduced a few measures, including one that required soldiers to store their guns on base when they went home on leave for the weekend instead of bringing them home. And the suicide rate overall went down dramatically in those soldiers, and it was specifically in weekends when they no longer had them. Similar sorts of regulations in the US that address guns directly have had similar results. When DC started requiring gun licensing in the 70s, firearm suicides dropped by 23% with no replacement with other methods. Dan Webster here at Hopkins did an early study that found child access prevention laws. These are laws that require you, if you have a kid in the house and a gun in the house, just to lock the gun up. It's a reasonable intervention to safely store your gun if you have a kid in the house. And when those laws went into effect, firearms suicides went down in teenagers, the ones most affected, by about 8%. Mike and Nestadt and Joy and Nestadt, they're a married couple that study this, have found that state laws that do anything to prevent access to firearms, whether it's requiring guns to be stored locked safely, like the Child Access Prevention Law, background checks, restrictions to open carry, all of these laws individually decrease suicide rates. And Kaufman, a surgical resident, actually did this study not too long ago that just compared states that had very stringent gun access laws to ones that had looser laws, and found that in states with very stringent gun access laws, the suicide rate was 20% lower than those with less stringent laws, controlling for anything else that might affect suicide, controlling for demographics, access, etc. So I want to get to the end here to leave lots of room for Shannon. It's important that people in the audience here who are clinicians screen for access to lethal means. When you have a patient that might be at risk of suicide, make sure they don't have access to a firearm or dangerous medications that they could overdose on. It's never illegal to ask that. Gun-owning patients should know the risks themselves and family members, especially if they suffer from depression or in a crisis. They should know they're far more likely to turn the gun on themselves than to use it for protection. Firearms should always be stored locked safely, locked separately than ammunition. That's one of the most important things you can do, especially to prevent youth suicide. You can access those guns. Guns can be temporarily stored at police stations, at shooting ranges, gun stores, and in some states, Maryland law is a little bit gray, can be stored with a relative or a friend in a crisis. So if someone's really in an acute crisis, it's not a good time for them to have a gun in the house. Maybe a neighbor or a family member could hold on to that gun. And in extreme situations where that's not possible or someone's not willing, might be at very high risk, extreme risk protection orders can be invoked. And you're going to hear a lot more about those in a minute. So in summary, suicide's a leading cause of death. The rates are rising and it's preventable. It can be an impulsive act and people use what they have. If attempters do survive the attempt, they have a good chance to get help. Remember, 94% of them will never go on to die by suicide. So if you can just stop that impulsive act, just have something not lethal there, they're likely to survive and keep surviving. In some places, those lethal means have been coal ovens or pesticides or Tylenol. In the US, the most available and lethal methods are guns. In rural areas in particular, I didn't talk a lot about this today, firearm suicides are particularly prominent. And long guns like shotguns and rifles, which only recently in Maryland became subject to the same restrictions as handguns, play a larger role. Screening for firearm access, regulating access to firearms, and requiring safe storage all generally save lives, all generally decrease suicides. They've each been tested individually and are a really worthwhile and helpful way to prevent suicide deaths. Room for questions at the end, I think, is how we're doing it.